And you can have many analytics. You can see how many people are posting. You can have very complicated analytics. You can see the relationships between members. And all this is done automatically with software that is being developed. And it's very similar to the concept of big data and all the things that are being developed, for instance, even for cancer research. So let's take hashtags a step further. There are communities right now, and not only peer communities, I mean not only healthcare communities, but we have communities from patients, and that's a very important thing because we have a revolution right now that's going outside our profession, and we should open our eyes and see it. There are patients that are chatting using Twitter and using hashtags directly with nurses, healthcare professionals, policymakers, advocates, anybody. So there are different topics. On Simpler, you can find these topics. But one of my favorites, and I have to promote this, is the healthcare social media in Australia and New Zealand, because it's one of, I think, the most friendlier communities out there. And we discuss each Sunday several topics on the social media and patient policies, etc. And actually, it's very good because in Europe it's like at 1 o'clock Central European time, so it's very convenient for us as well. So usually these communities select one topic each week, and everybody gets around at one precise moment, and they start tweeting, they start talking about that precise topic. So you can see here, for instance, a transcript from that Twitter. We have different people just talking about a topic that was provided to them. It's like a chat, an old-fashioned chat. Other useful way to use tweetsats are the journal clubs. So, for instance, there are some clubs all over the world that give journal clubs that give some a new paper, a new scientific paper to comment, and they meet at a precise moment and they discuss on that paper. And just to make a point on Raquel's comment about how important it is to have how important and how much impact have the social media. There is a journal right now that uses the two-impact factor, which in place of the impact factor that journals right now use. It's the Journal of Medical Internet Research with a normal impact factor of 4.7. That means that it's a very serious journal, and they actually evaluate each article based on the tweets, the mentions on the tweets that they have. And that way they can say which article may be of high importance or not. I don't mean to say that this is the right way to, or this is precise the right way to do things, but it's a good indicator of the things that are going to come in the future, and I think we all must be prepared for that. Now, my second part of the presentation goes beyond Twitter. I'm going to talk to you about an online platform that we are building, and it's aimed at collaborative research projects. It's a sort of a social network, a closed social network that enables healthcare professionals to conduct research all over the world. So imagine the challenge to make collaborative research. We have different sources, rural and isolated areas. We have people coming from rural areas in Australia, but we want to include also samples from Romania, from the UK, or from the United States. And all this, we have to put it together. We have problems about coordinating the researchers and make them engage, make them participate more, because those who are interested in making research know that follow-up data are really difficult to gather. And of course, we have the healthcare bubble. We are dealing with lots of administrative issues. We don't have time in our practice to do research. We have lots of organizational models, so it's really a mess. Of course, finally, we have data inconsistency. Many of us are working still on paper questionnaires, but also some programs that are used out there are not that standardized, and they don't speak one with each other, so you may lose lots and lots of information. So our question was, how might we make research multi-ethnic? Because we believe that research should not be only for white males from urban cities. How might we enable coordination and engagement? And finally, how might we involve patients into this process? So we are developing an online platform specific for biomedical research studies that enables a holistic approach for the development and coordination of projects and the collaboration between the stakeholders. So this platform looks like that. It enables you to create questionnaires online and with different kinds of fields, variables. And then upon your once you created this questionnaire, you can build your study, and you can use the previously created questionnaire for the study you are going to develop. You can set the cohorts, you can make longitudinal studies or whatever you want. And you can also manage the privacy, the private data. You can add demographics separately. You can also actually use several patients, one patient for several projects, and in that way you can share information between different projects. Finally, since we are in the 2.0 era, but we are also having problems with rural areas, for that reason, we are also offering an offline manager, a program that is installed separately and help you use this platform offline. So how can we involve patients in this process? We had the opportunity to work 6 months ago with the Patient Association, the Federation of Diabetics in my region in Emilia-Romagna in Italy, and they asked us, they wanted to evaluate the quality of the healthcare that was being provided to them by the healthcare system. It was a project that was being done in collaboration with healthcare professionals and the regional administration, so you can see that patients want to be included. And we saw the opportunity to change our platform in order to put new features such as the control of number of submitted cases, the automatic creation of QR codes, the supervision with the help of reports, and the sharing of information inside Facebook. So all this was integrated in the public campaign, which invites the people to answer this questionnaire. You can see the QR code down on the poster, and a patient, and this poster was in all the practices of my region. So everybody who was in their practice, they could just go with a smartphone, scan the QR code, and they would compile the questionnaire right at that time without losing the patient and without losing the information. So this is how it looked like. It was a tailored installation, and this is a questionnaire about insulin and the devices that they used in order to make self-check blood, in order to self-check themselves. We gave them also the opportunity to have like simple reports with simple statistics, so the patient association, the responsibles, could see live what was happening, how many questionnaires they gathered. And so we believe by building this system that is specific for healthcare, that we try to involve patients inside the process, we managed to increase participation, and all this can be done thanks to the cloud and thanks to the 2.0. Now, just to make a brief conclusion, we believe that we are going to have a research revolution because we need to optimize participation rates. Right now, research doesn't work well. We believe in crowdsourcing because people's peers and our patients can really help us in the research process. And we can help everybody to select their own interests online and do research from people all over the world, whether it is from Japan to Argentina. Now, as to the patients, by providing tools to the patients' association from the bottom-up approach of carrying out research projects, we actually we actually enhance their advocacy role, and their members will be empowered to participate more actively. And research quality, we think that can be improved that way when patients partner with researchers and policymakers in setting up projects with common objectives, as it was the example that I gave you before. So we hope that patients will be repositioned at the center of the healthcare, and their involvement in decision making will become the cornerstone of the new era of medicine and research. The new era of medicine that another great advocate, Eric Topol, calls the creative destruction of medicine. Thank you.